I'll go to my phone if
Okay.
my phone enough. Okay.
All right, everybody. It is time for the 3 o'clock session of the medical and healthcare industry. This is my good friend. We were colleagues at Jupiter High School together, but before I was a colleague, I was a student at Jupiter High School. And Miss Garcia has been a godsend to me in education, going through a career technical program. And I'm excited to just talk to you. Hi, Miss Garcia, how are you?
I am so wonderful, Mr. Hubbard, and thank you for your kind words.
Yes.
Hey.
Today's been hot. I'm wearing all black, so uh, but it is what it is. But I thank you for being a part of this discussion because I think right now we are in a time where um, nurses have stopped going to school, and they're doing virtual learning. They don't know if this is the field they want to get into. Doctors are concerned if they can't find a virus. There's so much going on with COVID-19. And I think it's important that we talk about this industry specifically, and probably get a little bit more in depth with COVID-19 versus the other panels because you're the frontline workers. And thank you for being a part of that industry, and guiding. You've guided so many young individuals into the medical field, and they are working this day in and day out, and we appreciate each and every one of you. To my friends that are in the front lines, to doctors that I don't know, to nurses, to anybody that's out there in the front lines, we appreciate you for what you're doing for us. But can you tell us where you started to get into this industry?
Well, I'm an old person. I'm retired. And I've been in medicine since 1977. So we're talking 43 years I've been in healthcare. And back in 1977, we were in the middle of a recession. I knew that I needed a job that could pay good money, and the healthcare field was that job for me. I started off and I worked my way through school. I started off as a nursing assistant and decided that this was good and it's wonderful taking care of patients, but I want more. I needed to learn. I am a habitual learner. I'm one of those seniors that just continually learns. And I started my nursing career at that point in time. I worked my way through being a nursing assistant to becoming a licensed practical nurse to a registered nurse. And then I have several certifications and moved forward from there.
That's amazing. And you are a registered nurse, correct?
Correct, I am.
All right. So your trajectory after you being in the hospital was to help students understand the medical field and get involved. And you, I believe, worked at Palm Beach Gardens High School.
Yes. I'm sorry, I didn't mean to interrupt you.
No worries. No, go ahead. Go ahead. It's a discussion.
Well, actually, my nursing career started up north, and I've followed different pathways, starting off in a nursing home with senior citizens. Once I got my degree, I moved into a hospital, and it's important to, while you're in school, network, build up friends, make connections. When you do your clinical studies, make those same connections because you never know who you're going to meet in the future. And I had left, nursing homes and had gone into the hospital. And while I was at the hospital waiting to be interviewed, one of my former classmates walked in, saw me, and said, "Whoa, hi." He proceeded to go into an office, came out, and looked at me and said, "You got the job." That was my interview. I walked in, and the nurse coordinator said, "Eric said you're a great student. You're a quick learner. We want you." And they threw me into the fire because I didn't work on a medical surgical floor. They trained me right off the bat to work in cardiac care and intensive care. So I was dealing with that type of clientele. In the midst of all of this, while I'm going through school and not school, but getting my training and whatnot, this ugly little thing reared its head in medicine called HIV. And we were all panic stricken because at that time we didn't know where the AIDS virus was coming from. And people were fearful. People decided at that point in time not to get into medicine because of the unknown. There was that fear. But once there was scientific proof and backing of how this virus was spread, people fell into line and got back into healthcare. From there, oh gosh, I thought that I was starting to get burned out in critical care. So I wanted to work in the newborn nursery with babies, which I did. But when the nurse supervisor realized that I had critical care background, she put me into the neonatal intensive care nursery, which means I was taking care of all the little premature babies, which was wonderful because I wanted to do babies. And I had that critical care background, so I could take care of these ill babies. The smallest baby that I took care of was little Miss Yvette. She weighed 1 pound, 3 ounces at birth. Her head fit here on my hand, her butt was here. And that was the size of this baby. She was the size of my hand. She survived. I get goosies. But I did that, and then this is a long story. My husband and I decided to move to Florida, and we went into the restaurant business. Yes, go figure. But nursing was always a backup for me. Obviously, I'm here today because the restaurant didn't succeed. But I started working, at that point, I started working at Jupiter Medical Center here in Florida, in Jupiter, Florida. And I was on a telemetry floor. That's patients that are monitored because of cardiac problems. So we had them on heart monitors, but also I would float into the intensive care unit. So I would go back and forth between those two units. And I did that for a few years. And while I was at Jupiter Medical Center, we used to have way back when technical schools that provided learning for students that didn't want to go to college but wanted a career pathway. And in those technical colleges, there was nursing, at that time, nail techs, automotive, electricians, plumbers, the things that you just think of industry. And there were student nurses that were shadowing me, and they would go back to school, to their school, and they'd say, wow, there's this wonderful nurse at Jupiter Medical Center. We really like her. And one day I got a phone call from their director, Janet Lang, who called me up and said, I'd like to have lunch with you. My students are talking about you. Had lunch with this young lady, and she offered me a job in education. So that was back in the 1990s. And I began my teaching career, teaching nursing students. And then I flopped because the technical centers decided to close. And then I flopped into high school. And I started teaching secondary high school health sciences. And I initially started working at Palm Beach Gardens High School, which gave me the opportunity then, while I was with my students, I was able to shadow them at Palm Beach Gardens Medical Center, the VA Hospital, St. Mary's Hospital, Good Sam's Hospital, and we also did a few different nursing homes, and also the health center on 45th Street. I worked at Gardens for approximately 5 years, and then I, for personal reasons, at the time my mother was ill and I was caring for my mother, And I live here in Jupiter. So a job became available at Jupiter High School, and which is right around the corner from my home. So I was extremely fortunate enough to obtain that job at Jupiter High School. And I finished out my teaching career at Jupiter High School while I was taking my students to Jupiter Medical Center. We also were at the Jupiter Pavilion, which is no longer in existence. And I also worked at the rehab center of Jupiter with my students.
Okay, so, and the reason why I wanted to make sure that we had that background is because you've been through pandemics, you've been through world health crises, I will say, especially with that HIV topic that we talked about.
Mm-hmm.
And I want people to see that there's a bounce back. There's a time where we're going to be able to bounce back and go forward. And the topic that I brought up is how do we move forward in this industry? And I think you answered it right on point when you said you just got to keep moving. You got to keep trying things. So when we look at your industry, what does it entail for us to truly get individuals to understand that you got to have the certifications, you got to have the degrees? What do they have to do to get into this industry?
Passion, first of all. You have passion. You have to like people because you're going to be with them day in and day out. And you're going to see people at their worst. But reversely, I always would say my patients were little gifts to me because I was able to improve their quality of life, help them improve their quality of life if that was what was happening. And also, you know, on the other end, not everybody made it, but I was able to be there to support them with their decisions. Nursing in itself, well, healthcare in itself is a teaching industry because whatever avenue of healthcare you decide to get into, whether it's occupational therapy, physical therapy, respiratory therapy, nutrition, biomedics, nursing, you become a physician, a researcher. There's always learning there. We're always giving back to our patients, our clients, and so we're always teaching them, and they're learning.
That is so true. I learned a lot when my dad, of course, went to the hospital and he had his heart issue. It was, we were concerned, and I reached out to you and I was like, what's going on? And I just remember you going up to the hospital and visiting them and making them laugh. So that passion really came through even as a teacher into the hospital. So I appreciated that when you did that for us because we needed it at that time.
You're welcome. And depending on what type of healthcare you get into, will dictate what type of certifications, what type of licensings you need. Because to practice any type of medicine, there is a standard, and you have to meet that standard, and not only meet it, but you have to maintain it. People that are out there right now that are in middle school, high school, if you get into a program, get into a curriculum that offers industry certification, because it's a great stepping stone for you. It gives you a wonderful basis so that when you go to further your career, your pathway, it gives you that basis that you've got a strong foundation. I've had students go off to college and be excused from their anatomy labs because they knew the 14er, which is the 14 points that a drop of blood takes to get through the heart and through the body. And they knew that. And that's what they learned in their industry certification. And regardless if you decide you don't want to go into healthcare, it's wonderful that you gave it a shot and you thought about it. And the knowledge that you've acquired in those classes will stay with you for life.
Yeah, the only reason why I couldn't do medical is I don't do blood or throw up or catheters. I don't do those.
That's the fun stuff.
Yeah. But these students that I think are the reason why we did this panel was because, you know, kids are wanting to get into the field, but they just feel like I don't know if this is the right trajectory for my life. And I like how you said there were some things that you started in healthcare, then you started a restaurant with your husband, and then you went back into the medical field. So I think it's okay to say that, you know, things may come along the way and opportunities. Should they take those chances and go and explore, or should they say, this is what I'm doing and move and keep going forward?
Well, so many students that I've seen in the past have said, I'm going to do this, and they've never faltered from their plan. As a matter of fact, I just saw one of my former students on TV. She was being interviewed on CNN. She's a doctor in Texas. I know. But you know, it's one of those things where with healthcare, okay, you'll always have a job because people always get sick. So, you know, if that's what you're thinking about, you know, do it. And there's so many different avenues in healthcare. That's, you know, just amazing. Like I said, I've got former students that are doctors, they're nurses. You know, my student Raj Para is a nuclear radiologist over at Jupiter Medical Center right now. Wow. You know, and there's, like I said, so many different pathways in healthcare. So you think, oh, geez, I want to be a neurosurgeon. And you're in med school and you go through cardiology, and all of a sudden it's like, bam, that's what I want to do. Forget the neurosurgeon. I love the heart. I want to work with the heart. You know, you get through your, you start your college career, and you'll meet people, and college is such a great thinking tank. And you just meet so many people, and you can engage and interact and get different ideas of what pathways you want to do. And it's okay to change your mind. It's an okay thing. My youngest daughter, you know, was 100% I'm going to be a doctor. She got into college and for her personally, looked at all the MD students and said, wow, I don't know if I want to sacrifice this much of my life to be a doctor, because she wanted to get married, have a family. We're working on that right now. But she, you know, she graduated, got her degree in nursing, practiced nursing for a few years, and then decided, I still want that little piece of the pie. I want to be able to do more for my patients. And right now, my degree is restricting me. She went back to school and got her master's in nursing. So now she works as an intensivist in Martin County because she's a nurse practitioner. So that lifelong learning, you can still always go back to school. You can always make different choices, different avenues. But, you know, the first thing is you have to make that first step. And, you know, Mr. Hubbard will agree with me because he's heard me say this 1,000 times. The worst thing anybody can ever say to you is no. If you never try, then you'll never know. You need to be your own advocate. You are your best investment. So if it takes you $90,000 to get your degree, you're investing in yourself. You're your best investment.
Now I'm gonna get into the serious stuff now.
Okay.
We've lost our local Santa Claus to COVID-19. I just heard the news of Jim Sparger passing away, but I don't believe it was related to COVID-19. But we've had some people close to us, and individuals watching this may have had people that they've come in contact with. What I've seen on Jupiter Locals, for instance, where there's people saying, the doctors killed my family member, or the doctors have not done enough, the nurses have not done enough, and we get that comes from anger sometimes, and we get that comes from beliefs of this whole virus. Nobody knows what's really going on with it. It's a new study of learning of a virus. How do we uplift those family members and those doctors and nurses that have tried to really figure this out?
It's definitely a struggle. My daughter is in the front lines. She sent me a text message 2 weeks ago that said, "Mom, I'm having a horrible week. I love you and Daddy. I'm so thankful that you're able to read this and respond." Because people are dying from this virus. Right now, the scientific world is working feverishly to get a vaccine out, okay? We've identified the virus, so we know what it is. We know how it's spread, okay? We just need now, looking forward, we need to develop that vaccine, okay? Because it is a flu virus. What makes it different from other viruses in the past is that those viruses we were able to identify and develop vaccines we were able to identify the viruses before they actually were released and were, within the world, because they've got different tanks and they're looking at different growths and viruses. So they would see the H1N1, okay, so they knew that it was happening, and they were able to develop vaccines. With the COVID-19, it just happened so quickly, and it was in the population so quickly that the researchers didn't have adequate time to actually develop those vaccines. So anything that these researchers and our pharmaceuticals, anything that they were working on, they've essentially put on hold because everybody now is trying to develop that vaccine, so that we can, bring the numbers down. I'm a firm believer of hand washing. As a teacher, to the classroom with high school students and watching everybody, oops, are you there?
Yeah.
Okay, because my screen just went black, but that's okay. Okay, alrighty. I don't know why my screen went black, but anyways, my students would, chew on pencils and have their hands in their face and, in the potato chip bag, and then offering potato chips to everybody, taking the drink and saying, "Hey, can I have a sip?" Don't do that. And so, keep your hands away from your face. I firm believer, wash your hands. I'm a masker because I'm an old lady and I'm in that age group where I could get the coronavirus. So I'm masking every single time I go out. I wash my hands constantly. And, I just think that if we just be vigilant and we follow medical advice, scientific advice, this will pass. We're seeing, just in Palm Beach County, because our elected officials have mandated that we wear masks when we go out into public spaces, that we have crowd control. Our numbers are going down. So there's got to be some weight to what, the medical community, what the scientific community is telling us. So I think, with that being known, I know medically, I just read an article today that they found steroids, prednisone, is now really being helpful with COVID patients. The thing initially was, if your oxygen saturation drops, we have to put you on a ventilator. Well, they're finding that this virus is just has its own game plan, and not everybody has to go on a ventilator. They just need oxygen support. So, it's tragic that we've lost as many people as we have, and this is a learning process for us all, but we're seeing better outcomes now in regards to the COVID virus than we were 8 weeks ago or 10 weeks ago.
Yeah, and before we hopped on here, the live session, I was saying to Miss Garcia that I'm so glad that I'm not in the classroom right now because one, I don't want to be a carrier or spread the virus, and I also don't want a student coming into my classroom and spreading that. But I do understand also the hardship that it's putting on parents to get childcare and send their child to school because that was a place for them to go. So I understand both sides, but what advice can we give to our teachers? Because we were in the shoes not too long ago. You left in March. I left in December of 2018. What advice can we give to teachers to, say that we got your back and we support you?
Well, I think first of all, because I've been reaching out to teaching friends, I think, as far as our teachers are concerned, we need to first of all, respect their choices, respect everybody's choices. And, at times we're asked to do things that we don't agree with and we don't like, but for the well-being of everyone, I think we have to move forward. We need to be responsible citizens, and we have to be responsible for the other person, the person sitting next to me. We're in the classroom. Be responsible and do what we're asked to do. I know teachers are just having a tough time, virtual learning. Some students also just love it. Others hate it because like that one-on-one, face-to-face contact with their teachers. I know that this time in our lives and history, it's going to pass. We're going to go back to the new norm, but the new norm will be in the classroom. And students will have that interaction, I believe, once again with their teachers.
Yeah, and students that are out there that are listening to this, we as a society don't know what you're going through mentally or personally, but we want you to know that it is okay to have a conversation with somebody, whether it be that you're having a hard time with a subject or that even if bullying is happening, we tell somebody. It's very important, especially with COVID-19, that we look at people's mental health and staying inside and watching others do something that they wish they could do. We see you, we hear you, we want you to talk more, okay? Miss Garcia, I thank you so much for your time. I'm glad we got a little insight into COVID-19, especially from somebody with your resume that has dealt with multiple issues within our America. But I miss you. Happy retirement. And I can't wait to see you in around town.
Really? Same here. And thank you for the invitation. Please know that I'm here to help you anytime.
Thank you so much. Well,
You're
y'all,
welcome.
that wraps up the 2020 Rise Above Conference. Look forward to more coming your way. GetConnectedFL.com. You can find more information about our company. If you are somebody that you know would like to be a panelist on our show, give us a call at 561-386-3781 or email johnnylhubbard@gmail.com. Thank you again so much, and we hope that you will rise above in your future endeavors.